Tuning in, our next presenter is Zoe Giwa, and she will be presenting on the misconceptions of plastic surgery, and she will be starting at 1 p.m.
My name is Zoe Giwa. Thank you guys for tuning into the presentation about the truth about plastic surgery. What do we think of when we hear plastic surgery? Most of us answer with something including the Kardashians or involving cosmetic surgery. This picture includes a woman with the nose covering after rhinoplasty and the injections of possible Botox or fillers. In reality, plastic surgery is so much more. Plastic surgery is also reconstructive surgery. This is usually considered as the essential side of plastics, where surgery is used to restore the form and function of the body, not including aesthetics. On the other hand, cosmetic surgery is enhancing appearance through procedures. So today I plan on talking about the basics about plastic surgery, some stigma surrounding plastic surgery, some patients I've encountered, procedures, interview that I had with the patient, Hollywood versus plastic surgery, Dr. Miami, and finally my concluding thought. So what exactly is plastic surgery? The name origin is from the Greek word plastikos, meaning to form or mold. Plastic surgery specializes in both a person's appearance and their ability to function. The goal is to improve patients' appearance, self-image, and confidence through both reconstructive and cosmetic procedures. The two main types of plastic surgery. The first main type is reconstructive surgery. This is usually employed for medical purposes. Some examples of this is being the cleft lip surgery, breast reconstruction surgery for those who have had a mastectomy, and contracture surgery for burn survivors. The second main type of plastic surgery is cosmetic surgery. This is usually for aesthetic enhancement. Some examples of this is a tummy tuck, liposuction, breast lift, cheek augmentation, breast reduction, and enlargement. So, the purpose of my project. My project is designed to alleviate some of the negative stigma that people have towards plastic surgery by sharing the truth. I chose this topic because I would like to be a plastic surgeon in the future, more specifically a cosmetic surgeon. While I believe that cosmetic surgery helps people feel confident about themselves, and this has always been something I aspire to do, I've also learned about the importance of reconstructive surgery. Reconstructive surgery includes treating burns, hand surgery, skin grafts, and cleft lips. So my approach. My approach to this project was to meet with both a cosmetic surgeon, Dr. Pan, and a reconstructive surgeon, Dr. Shaw. I also researched many articles and watched TED Talks and had an interview with the patient. So, working with Dr. Pan. To begin with, my project began by me reaching out to several plastic surgeons in the area in hopes of finding a mentor. I first met with another cosmetic surgeon in Guilford, and the plan was to shadow surgeries at Yale and have office days where I would shadow what it would be like day to day. Unfortunately, this did not work out, therefore I went back to the drawing board. I reached out to several more doctors, but after a few weeks of no response, I began to feel hopeless. This is when I reached out to Mrs. McDonald, and she quickly set me up with Dr. Pan, another cosmetic surgeon in Guilford. I never got to shadow a surgery with Dr. Pan, but I did get to interview a patient and learn more in depth about how procedures are done, what goes into patient screening, and before and after results. So some facts I learned with Dr. Pan. There is a screening process in which all patients take to rule out if mental health is a factor for the procedure. Next, I learned that new technology is coming out to help reduce the amount of invasive surgeries. My next fact is that in the Northeast, most patients are middle-aged women looking to, one, reduce the appearance of aging through Botox or fillers, get a breast lift after having children, cool sculpting, or a tummy tuck. Next, I learned that cosmetic surgery is a want, not a need, so it should not be stigmatized. The way we feel about ourselves plays a major role in the way we present ourselves, too, and the way in which we interact with others. Finally, it is possible to get addicted to cosmetic surgery, which is why many doctors have screening practices and carefully follow up with patients. So, the most common surgeries First is the tummy tuck, aka abdominoplasty. This reduces the appearance of a protruding belly or loose skin. This helps with stretch marks in the abdomen and is most common as a result of pregnancy or of age or obesity. Finally, eyelid surgery is used to help perform aging problems or to treat inherited traits. It helps fix puffy appearance of the eyelids, excess skin or wrinkles, bags and dark circles, and at the end, surgery and other treatments may be needed to fully resolve issues. So some before and after photos of cosmetic surgery. On the left, we have a woman who had gotten rhinoplasty. She has a more protruding nose at the second and after picture. And on the right, we have an older woman who had gotten some excess skin from the chin removed, and this was done. Working with Dr. Shaw. Dr. Shaw is a reconstructive surgeon who specializes in hand surgery at Yale. A few weeks after working with Dr. Pan, Dr. Shaw got back to me to schedule a meeting. Our first meeting went great, and he left me with many resources to use for research before our next meeting. We had a few more meetings, but he increasingly became more busy since he worked in an emergency room setting. Eventually, I mainly worked with Dr. Pan and watched documentaries, read articles, watched TED Talks, and researched several studies. By the end, I have both learned about the reconstructive side and cosmetic side of plastic surgery. So here is some before and after photos of some reconstructive surgeries. We have a woman with a disfigured face and it looks more normal after. And then the second photo we have on the right is to fix a hole after a gauge piercing, and it is closed in the after picture. So my favorite procedure, the cleft lip. Dr. Pan produced a PowerPoint that helped me understand the goals and objectives of this surgery. She also helped me with the conditions and width in which the procedure is performed and the theories and ideologies that surround this procedure. I have learned several techniques and have heard specific stories about the patient and how this cleft lip defect affected their everyday life versus the after procedure in which they are able to breathe better and speak clearer. Finally, I was able to understand the medical terminology to describe the procedure and parts of the mouth. Next was my interview with the patient. This interview was so crucially important to my research and project. Up until this interview, I had not discussed a procedure in the before and after with the patient of Dr. Pan's. During this interview, I had learned about the journey of a patient who previously had breast cancer and how she got a mastectomy and breast lift with Dr. Pan. I then learned that after she had made recovery, over the years, age and weight loss has made her continue to get cosmetic procedures. She made it clear that her cosmetic surgery is not what people see on the TV. It is her trying to keep up with technology and keeping up with her natural appearance. Since the mastectomy and breast lift, she has gotten cool sculpting and fillers to maintain her beauty. She even jokingly said without it, she would feel so old, and that plastic surgery has not only saved her at her roughest times, but also boosted her confidence. This interview was important because I am now aware of a real-life patient who had gotten both reconstructive and cosmetic surgery and how it has changed her life for the better. So what happens when Hollywood and plastic surgery is combined? I first want to talk about the movie The Breast Man. This movie is about two doctors who created breast implants, as this follows them over the years. However, when success and money comes their way, they separate and follow different paths. One doctor gets wrapped up in the fame and making breasts larger and ends up getting multiple lawsuits for malpractice due to the silicone implants rupturing. So some effects on surgery that this has is that specific body types becomes trends. Media also promotes a specific image that causes insecurities. Next is religions would say that people should not be changing the way they were born. This overall creates this negative stigma. People are feeding into society's standards of beauty instead of appreciating their flaws. One doctor that we commonly see in the media is Dr. Miami, and if you are on social media, you have most likely heard of him. He gets millions of videos per millions of views per video. He often Snapchats his surgeries, and many of his surgeries are meant to produce the same body shape and result. While he is informative, he has received criticism on business etiquette. He is seen dancing or rapping with an open patient on the table. He also takes most of his after pictures on the table, which may not accurately depict after surgery results. So finally, I have this video. So, this woman is seen criticized for her natural body and gets surgery to fit an unrealistic body type to seek people's approval, but at the end ends up falling apart. This shows some of the negatives about plastic surgery. In conclusion, this project meant a lot to me because I learned a lot about plastic surgery and hope to apply it in my career. I learned business etiquette, how it is like to be in a professional environment, especially one that I see myself in, and I also feel more confident in the path of becoming a plastic surgeon. I believe that if plastic surgery is done reasonably and produces the natural appearance that meets a patient's desire, it is helpful. I would not have changed my project at all. I feel like it was all a learning experience. Dr. Pan was so helpful in the whole process and guided me so greatly. In all, I took this project seriously, and I took a lot of time during the school year to work on it. I feel very happy choosing something that I am interested in pursuing in the future.
Well done, Zoe. Really impressive. I love that video at the end. It really kind of puts it into perspective and what goes through people's minds when they're going through this. And I think it really sends an interesting message. I really enjoyed watching that. I'm glad that it was a good experience for you. It sounded like it really helped clarify a career choice that you had. I know at the beginning of this project, you told me that plastic surgery was something that you were thinking of going into in terms of medicine. So I'm glad that it put you in the direction of feeling more solidified about that choice and considering it. That's wonderful. Was there anything that surprised you in your research or working with Dr. Pan? Anything that you were just kind of taken aback by that you didn't expect to learn?
I did, well, to begin with, I was one of the biggest fans of Dr. Miami. I'd always watched it, and I didn't necessarily know much about plastic surgery outside of Dr. Miami or watching shows like Botched. I mainly saw what was on the media. So I was more interested in seeing how was it in real life for day-to-day patients, and Dr. Pan really helped me with that because I got to see someone more local and seeing what women in the area would do.
Awesome. Do you find that plastic surgeons tend to focus on mostly all areas of surgery, like the cleft lip, as well as elective reconstructive surgery, that they do a little bit of both, or do you find that it's separate?
From what I've heard, Dr. Pan said that she was doing reconstructive surgery mainly in her earlier career, but as she branched off, she she solely became a cosmetic surgeon. And from Dr. Shaw, he is a reconstructive surgeon but specializes in hand surgery, so he doesn't necessarily do the other things, but I feel like they more go narrower versus broader.
That makes sense. Awesome. So for those of you tuning in, you could use the chat feature on the Zoom screen on the bottom in the middle if you want to make comments or ask questions, and we could read those aloud for you. So we got an awesome project comment. We agree. And you're a senior, right?
Yes.
Okay. So are you starting your studies in regards to science and medicine next year?
Yes, I'm majoring in biology.
Excellent. Where will you be heading?
I'll be going to Temple University.
Great choice. Another comment, any increased interest in reconstructive surgery?
Well, I personally have always wanted to go in cosmetic surgery, but I definitely have a greater appreciation for reconstructive surgery. I don't think that I would necessarily go into it.
Makes sense. Awesome. All right. Well, that concludes Zoe's presentation. Our